let's move on to the next question. Okay, so why have my gums receded? So I guess maybe let's explain what that is first, and then we can go into the, the cause.
Yeah, sure. So gum recession is so that when we're born, or kind of when we're 100% okay as such, the gum comes to a certain level on the tooth, and it's usually kind of where the enamel ends, and that gives the tooth a nice shape, and stops the root being exposed and getting sensitivity. For a lot of different reasons, we'll find that patients get that gum will very slowly sort of recede back from a tooth or lots of teeth. There's a lot of complex reasons as to why that happens, but they're probably in the minority as to why that happens. The big ones are it's due to being aggressive with your toothbrush. So you kind of, if you're getting in there, you're traumatizing that area. Eventually the gum's going to give up and it'll kind of just slowly recede. And we tend to see it maybe a little bit more with manual toothbrushes, hard brushes, around the corners of the mouth, and you'll just see the root surface just starting to dip up just a little bit by little bit. You tend to get some symptoms with it, on and off. You'll get, cold sensitivity, or you'll see it, but usually you get that cold sensitivity that comes with it. So that's probably one of the big reasons why it happens. The other one is gum disease. So if you've got chronic gingivitis, like chronic inflammation of the gum, it will tend to recede back as well. Probably the biggest one, and where the term, getting long in the tooth comes from, is from the other, more severe form of gum disease called periodontitis. So that's when the bone itself gets destroyed around the teeth due to a different type of bacteria that's in there. So as the bone goes away, you tend to get the gum sort of slowly going back as well. So that's called periodontitis, gingivitis. So they're the two main types of gum disease. And then the other third cause is toothbrush trauma.
Okay, cool. And so what can people do, like if they have developed gum recession, but the gums don't grow back, which people might not know, so it won't grow back, but what options do they have once they've...
I think the first thing for that is to understand what's caused it and remove that. So if it's toothbrush abrasion, hey, take it easy, stop scrubbing your gums away, get a softer brush, maybe switch to an electric, but talk to your dentist about it, because as I said, there's a small percentage of these cases where it's caused by something a little bit different and really unusual. So I think it's just getting to the cause of what it is. So see your dentist is probably the big thing. So they'll check for gum disease. They'll, be able to very quickly tell you as to what it is. So there's not a whole lot you can do to repair the situation. There's gum grafting that can be done. But typically kind of once it's gone, it's gone as such. Yeah.
And then if they are suffering from that cold sensitivity because they've got an exposed root surface, there are products out there as well. So if they go to the dentist, they can have a chat about that as well. So you don't have to suffer with the cold sensitivity just because your gums have receded, which is great. We've got so many awesome products out there now.
Yeah, fantastic products. They're cheap, they're readily available, and for most people, they make a significant difference. It's just a matter of switching your toothpaste out or adding a product on there, or, in some cases, it's avoiding a certain type of diet, which might exacerbate it, Red wine, for instance, it's like anything kind of acidic is going to get in there and sort of just strip away that protective layer around the root surfaces and exacerbate those symptoms. So, yeah.
Okay.